So yes, we'll just give you a very brief overview of the methodology that we've used. So the research, as you'll probably get a flavour of already, was undertaken using an engaged approach, and we're going to go on to say a little bit more about what we meant by that. So we carried out focus groups and interviews in the 2 low-income areas that were part of the study, and we used a narrative approach. So we asked questions about the stresses and the difficulties that people were facing, and basically people told us their own stories with their own priorities. We also interviewed GPs in the study sites to understand how GPs perceive and respond to poverty-related distress. And as well as doing our own primary research, we undertook conversation analysis with video-recorded mental health consultations from the 1 in a million data set, which is held at Bristol University. So conversation analysis involves studying the social interaction between 2 people. So in this case, obviously between the GP and the patient, to look at exactly how things get done in consultations. So for example, how does a patient disclose their mental distress? How do GPs ask if a patient has thought about harming themselves? How do GPs recommend treatments? And how do patients respond to those treatment recommendations? So through microanalysis of multiple interactions, these can reveal details and patterns in the data that we might be unlikely to see through other research methods, and enables us to better understand what makes good communication.
Thank you. So what do we mean when we say we took an engaged research approach? Well, for us, it's working in partnership from the outset to understand the nature of the issues, to co-create the questions, to work in partnership on the design and the delivery and the dissemination of the research, and to ensure, as far as possible, that there are mutually beneficial outcomes for all partners. So within the DeStress Project, we had a commitment from the outset when we were writing the proposal to work with our community partners. So in the writing of the proposal, we went to the study sites, we spoke with people, we spoke about the research aims and objectives that we had, and we negotiated these and sort of in a way sought approval to put the application in. People have worked with us on the design and the delivery of the research, and not just on our advisory board, but throughout the whole process. This has also meant challenging some of our university research structures and processes to ensure that they worked with and didn't work against our engaged research approach. And we've spent quite a lot of time trying to understand what mutual benefit looks like for everyone.
So just to explain some of the practicalities of how we went about this. So I spent probably about the first 3 months of my post basically just building links within the community and talking to people about what we were hoping to do, finding out who was interested, and just going to things like housing association meetings, parent and toddler groups, children's centres, lunch clubs, school open days. And as time went on, this also became a bit more targeted. So we realised that it was quite hard to talk to men. So we did things like make links with an informal veterans support group and go into a homelessness hostel and go and talk to a gardening group and things like that. We also have Suzanne, who you've probably all met at the reception desk, who's part of the DeStress Project as research support, and she also works on the C2 Connecting Communities programme. So she's been really important through both of those roles and throughout the life of the project of just maintaining those links within the community. So making sure at whatever level people want to carry on being involved, that they're getting the information, that all the practical things are in place to make sure they can come along to meetings and events that they want to come to, and just generally making sure that everybody's in the loop. So the first stage of our data collection was that we held 16 focus groups over time with a total of 97 people aged between 18 and 65 to find out what it's like living in their area, what are the pressures and stresses that people are experiencing, and how do they deal with them. So the focus groups were held in times and places to suit the people who were coming along, so they happened in pubs and community centres, outside in the case of the gardening group, or just wherever made sense for people. We did in-depth interviews with 57 people who were experiencing some kind of poverty-related distress to understand if, how and why people did seek medical help, and then how that impacted on their health and well-being. So again, we used a mixture of recruitment methods, a lot of the places that I've already talked about, to try and recruit a wide range of people. And we also recruited through GP surgeries to try to make sure that we were reaching people who could maybe be more socially isolated. And then we did some follow-up interviews 4 to 6 months later with 23 people who were kind of involved in the healthcare system in some way related to their mental health. We did interviews with 10 GPs, and we also used conversation analysis to analyse the 52 of the video recordings of GP consultations that had a mental health component. So what people were saying in the focus groups and the interviews influenced the questions that we asked of the GPs, and also the way that we analysed the video consultations. So what people were saying in the communities was influencing the research as it developed.
So actually taking this engaged research approach has, I think, really made the research possible. And you've heard about the incredible number of interviews and focus groups with people of all ages and both genders in the community. And I think this was only possible because of the help of our community partners. So there's the very practical side, but they've also really been involved in shaping the research as it's developed. In helping us interpret the findings, so we're not just looking at them through a researcher lens. In co-producing the training materials, part of the training materials contain some little vignettes, some little case studies of people talking about their experiences from the study sites, and I think you're going to see a couple of these in the presentation. And I think these were only possible because they were made by our community partners. We co-present the findings as we're doing today, and because of this engaged research approach, other people have come up to us, talked about research that they would like to happen. So we're looking for funding, and we're supporting other pieces of work within both study sites. So that's it from our perspective. What I'd like to do is hand over to Rachel, Hilary, Jenna and Kirsty to talk a little bit about why you got involved with DeStress and the impact that you can see you've had on the research.